Good morning. It's 11:30. Thank you. Good morning. Welcome to Health and Human Services on this Friday, April 4th. Secretary, will you please call roll?
Assembly members Dahlia, Edgeworth, Gonzalez, Goulding, Gray, Hafen, Hibbets, Hunt, Jackson, Koenig, Nadeem, Wynn, Ortlicker, Chair Brown May.
I am here. Thank you. Thank you all for being here. We have a great agenda today. We have 3 bills. Before we begin, I'm going to ask you to humor me for just a minute. I had the honor of meeting with a teacher last week who hails from McKinney, Texas. She is an 8th grade civics teacher. Her name is Mrs. Fitch. And I told her that as we call to order today in Health and Human Services, that we would give her and her class a big shout out. So they're hailing from McKinney, Texas. They are watching us online today about the importance of civics and leadership. So they are currently studying how to be a good leader and by engaging everyone in conversation around the issues that are important to them. So big shout out to Mrs. Fitch and her 8th grade civics class in McKinney, Texas. And then we will connect with them in the future. Okay, members, with that, we're going to start our agenda today. But first, we will get into our housekeeping notes. As a reminder, please silence all of your electronic devices. If you wish to testify, sign in at the table. Members of the public may provide testimony online or by telephone or here in person. By telephone, you would dial 888-475-4499, and then today's meeting ID is 870-308-83942, and then press the pound sign. Meeting agenda and committee information is all available on Nellis. And you can access that through the legislative website or through our YouTube channel. As a reminder, courtesy and respect in all of our interactions. And as a reminder, committee members will be using laptops to view handouts and other documents. Please don't view this as a sign of disrespect. For the members that we have, Assemblymember Koenig, please mark absent excused today. The other members are present when they arrive as they are presenting a bill in another committee. And with that, we will officially open the bill hearing for Assembly Bill 514. We will invite our Assemblymember Jackson to the table to present this measure for our consideration.
Jovan Jackson for the record. Good afternoon, Chair. Good afternoon, committee members. I am Jovan Jackson representing Assembly District 6. Thank you for allowing me to represent AB 514 on the behalf of the committee. This bill comes from the Joint Interim Standing Committee on Health and Human Services and requires Medicaid coverage for care provided in therapeutic group homes to people with serious mental health problems. So during the pandemic, I did run a housing program for those who are mentally ill and disabled. And a lot of these individuals need mental health services in the home, just not housing. A home could feel isolating and can hinder those who are already experiencing mental health problems. And it's so important that we pass this to ensure that the most vulnerable populations have services within the home. This bill ensures that treatment is provided at home, and it also has the potential to reduce hospitalization and incarceration. So this may be one of my personal bills because it has a major amendment like the rest of my bills, but it is a joint committee bill. The amendment proposed There is a proposed amendment that comes from the discussions with Medicaid to make this proposal more feasible and model it after existing Medicaid benefits for residential substance use disorder. The amendment would instead require Medicaid coverage for rehabilitative residential mental health care. This is a community-based medically monitored level of care for a client in a licensed residential setting that uses established rehabilitative principles to promote a client's recovery and to develop and achieve psychiatric stability and personal emotional adjustment, self-sufficiency, and other skills that help a client transition to a more independent setting. So this bill focuses on bringing it back to the community instead of hospitals, instead of jails, instead of inpatient facilities, and puts the focus back on the community where these individuals are more likely to have access to the resources they need, they have more access to the care that they need, and I think it's important that we get people in their homes where they feel most comfortable. This amendment will also require the Division of Public and Behavioral Health within DHHS to develop a new licensure model that meets federal regulations. The State Board of Health would be responsible for adopting regulations for these facilities, which includes distinct requirements for providers serving youth and providers serving adults. There should be a Medicaid representative nearby for questions. I want to thank the chair and thank the committee members for allowing me to present this bill. And if there's any questions, I'm here.
Thank you, Assemblymember Jackson, for your presentation. We are, I believe, preparing to upload the amendment that, do you have a hard copy with you? You don't, okay. Thank you. Staff is working on that currently. Thanks. We'll stand in a brief recess 1 second while we get that amendment, just so members have it, and then we'll start questions. Okay, members, I understand that it is now uploaded as well, so you should be able to access it online. And Assemblymember Jackson, do you have a phone a friend relative to the amendments that we are talking through here today that you would like to invite to the table to help answer questions? Thank you so much.
Thank you, Chair. She's coming up.
Thank you for joining us at the table. We appreciate that. I'm wondering if you would state and spell your name for the record and then walk us through a little bit of what prompted the amendment that we have in front of us.
Absolutely. Thank you, Madam Chair, committee members. Ann Jensen for the record, ANNJENSEN. I'm the Innovation Officer at Nevada Medicaid, and I'm happy to share a bit more about this amendment. The intent is really to ensure that the language of the bill aligns with our ability to submit a request for federal approval for this type of model. This request, we believe, would fall under the rehabilitation option of our state plan. This speaks to the Title 19 of the Social Security Act that would allow us to provide a reimbursement for these services. And what's really crucial is that Medicaid can pay for the services delivered in this setting. And so we wanted to ensure that was clearly reflected in the bill so we can submit a request to the Center for Medicare and Medicaid Services that could be approved. Thank you.
Thank you, Ms. Jensen. I appreciate you being here. Thank you. Members, are there any questions? No, no questions. Oh, that's good. Thank you so much. Ms. Jensen, are you able to tell us how many rehabilitative residential mental health care homes we have currently in the state? Any, just roughly?
Madam Chair, Committee, and Jensen, for the record, I do not have that information for you right now. We can follow up likely with our colleagues at the Department of Public and Behavioral Health. This would be a new service model for Medicaid, so there's no one currently delivering this particular array of services in the model that we would be seeking compensation or seeking coverage for.
Thank you. I appreciate knowing that it is a new service model. Is there data to support that this type of model is the next logical step in how we're serving the constituency that is looking for this?
Madam Chair, Committee members, and Jensen, for the record, I'd be happy to follow up with you on data itself, and if Assemblymember Jackson has any detail from the interim Health and Human Services Committee intent in bringing this bill, we can share that. From our feedback from providers, though, we know that there is always need for additional medical services to support people transitioning from more acute settings, such as hospitals, into living on their own in community settings. So we believe there is a need, and I'm happy to provide that data as helpful, but I do believe that was something considered in the interim, and so we can refer back to that as well.
Thank you for your comments. I appreciate you. Thank you, members. Any other questions? Okay, it clearly is a Friday. Thank you very much for your presentation. We'll ask you to go ahead and step back. At this time, we'll open up testimony in support of Assembly Bill 514. If there's anyone here who would like to offer support for this measure, please come forward now, both here in Carson City and in Las Vegas. Thank you. Go ahead. You may begin when you're ready.
Good morning, Chair and Committee. My name is Sabrina Schnur, Sabrina Schnur, and I'm here today on behalf of the National Alliance on Mental Illness Nevada chapter, NAMI Nevada. We just wanted to note that community-based living environments can be successful for persons with mental illness and are important to stabilizing them within the community. We'd like to thank the bill sponsor and the committee for hearing this bill today. Thank you.
Thank you for your comments. Seeing no one else here in support and no one in Las Vegas, AVH, is there anyone on the telephone line who would like to offer comments in support of Assembly Bill 514?
If you would like to testify in support of Assembly Bill 514, please press star 9 now to take your place in the queue. Caller with the last 3 digits, 535, please press star 6 to unmute your phone. You may begin.
Hello, this is Carissa Pierce with Children's Advocacy Alliance, CARISSAPEARCE. We would like to give our support to this bill. We see it as an opportunity to help with the community aspect of mental health care, where we just have, or we're working on the inpatient part of it, and now we need that community support as well. And so we appreciate the sponsor for bringing this bill forward and look forward to seeing it hopefully progress through this legislative session. So please consider voting in support of this bill. Thank you.
Chair, there are no other callers to testify in support at this time.
Thank you, AVH. At this time, we'll move into opposition. If there's anyone here who would like to offer testimony in opposition to Assembly Bill 514, please come forward here in Carson City and in Las Vegas. Seeing no movement, AVH, is there anyone on the telephone line who would like to offer testimony in opposition of Assembly Bill 514?
Chair, there are no additional callers to provide testimony at this time.
Thank you, AVH. At this time, we'll move into neutral testimony. Is there anyone here who would like to offer testimony in neutral on Assembly Bill 514? Please come forward here in Carson City or in Las Vegas. Seeing no movement, AVH, is there anyone on the telephone line who would like to offer testimony in neutral on this measure?
Chair, there are no additional callers at this time.
Thank you, AVH. Would the bill sponsor like any closing comments? No, we're being waived off. Thank you very much. At this time, we will close the bill hearing for Assembly Bill 514 and welcome our member back. At this time, I am happy to open our bill hearing for Assembly Bill 521, and we will welcome Assemblymember Anderson to the table. You are welcome to begin whenever you're ready.
Good afternoon. Good morning, almost afternoon. Health and Human Services, thank you. Chair Brown May, Vice Chair Nguyen, who's not here, and members of the committee. I just ran down from my other committee.
You can take a breathe. It's okay.
Thank you, though. Seriously, I really do appreciate standing in front of you today again to present a different bill. My name is Natha Anderson, and I have the honor and privilege of representing Assembly District 30, the heart of the Truckee Meadows. Today I'm presenting to you Assembly Bill 521. This bill was inspired by a series of audit reports from the legislative auditor regarding governmental and private facilities for children. Just a small amount of background information. The first audit report came in January of 2024, and that included a recommendation to require health care facilities to screen employees for a history of child abuse or neglect of people that might have been accused of this. The second report, which was just 11 months later, from December of 2024, repeated that recommendation. Realities are currently healthcare facilities licensed by the Bureau of Healthcare Quality and Compliance, or HCQC, are not required to screen employees who have direct contact with children for substantiations of child abuse or neglect. Specifically, these facilities are not required to submit employees' names to the statewide, let me make sure that's clear, statewide central registry for the collection of information concerning the abuse or neglect of a child prior to employee's hire. A submission to this registry is called the Child Abuse and Neglect Screening, or CANS. While some facilities voluntarily do so and make the decision to do so, of the 15 facilities that were inspected in 2023, 9 did not. Only 6 voluntarily did the screening. Having no requirement to perform these screenings actually introduced the potential for people who are known to have neglected or abused children to work in an environment with direct contact with our kids. From the January 2024 report to the legislative auditor, the governmental facilities considered included any facility owned or operated by a governmental entity that has physical custody of children pursuant to the order of a court. The bill's summary, it's very straightforward. It directly addresses the issue raised in the audit reports by requiring facilities licensed by HCQC to perform initial and periodic child abuse and neglect screenings of all employees. This process requires a facility to submit an employee's name to the statewide central registry to determine if there has been a substantiated report of child abuse or neglect against the individual. Additionally, the bill requires a transitional service organization to terminate the employment of any employee who provides services to persons with a disability or a child if said employee has, again, a confirmed report of abuse or neglect of a child against them. I am trying very hard to be very analytical with this topic, but I need to be very candid with you. It's difficult to do so. And I think all of us know why. It's because the individuals that are able to skirt or avoid these background checks are predators. And they know exactly how to play the system so that they can get closer to children who are already vulnerable, who are already feeling that they are not enough for whatever reason. Maybe it was because of something that happened to a family member, whether that family member was somebody that they were born to or somebody that they chose, that then has forced them to no longer be with that family. Maybe it is because of something else that has happened to them. The children that are in these facilities are children that are most vulnerable and already emotionally hurt. And they lash out in different areas. And I know, looking at this committee, many of you know who those children would be. Because you know that many times that they are in these facilities, not because of who they are, but because of the people around them and how they have hurt them. And the individuals who are able to be employed, who do not go through the proper background checks, prey upon these children. And that's unacceptable. This is just too important for us to say, that's the audit report. Thank you, let's move on. This is a way for us to be able to close an unattended loophole. Because what happens currently in some of our language is that there is an FBI check that has to be done. And that FBI check is very thorough, but it is not consistently used in all of these facilities. It's only some of them. And this is one reason why the auditors have asked that we consider a possibility of making this change in our NRS statute so that it is consistent, it is clear, and nobody can find this loophole to prey upon our kids. I believe AB 521 would enhance the protection of our children in these facilities. I want to, before opening it up for any questions, I really do want to make sure to thank the legislative auditors who have done this report twice. In particular, Haley Cornelia Swift, Monica Seifer, Jennifer Otto, and Todd Peterson, who performed the audits. When we enact laws, when we set down the words, we create words. Our auditors are the ones that are making sure those words are reality. And they look at the language that is being presented by these organizations. But the difficult thing, if you ever get a chance to look through these two audit reports, is they go to the facilities as well. And they talk with our kids. And they talk with others to make sure that what is happening should be happening. They see the realities. This oversight was brought up, and we need to fix it. I'm ready for any questions that the committee may have. Thank you, Chair, for this opportunity.
Thank you for your presentation. We will start with Assemblymember Edgeworth.
Thank you. Thank you so much for bringing this bill up. What a shocking loophole this is, actually. My question is, did the auditors, I'm sorry I didn't read the audit reports, but did they happen to bring up any particular statistics about how many crimes might have, I mean, you can't probably document grooming and the terrible things that are going on in the background, but were there legal matters that came up or indictments or anything like that from their audit?
Thank you. Through the chair to Assemblymember Edgeworth, thank you for asking that. They did not. And I think the main reason why is instead is because they were looking at the facilities themselves. And they were looking at the practices that are within our legislative language and making sure that that language is being enacted. The other possibilities, though, I think we've all seen, unfortunately, both nationwide as well as in our own state and sometimes in our own counties, how this is a reality. At this time, though, that information is not part of the audits. I can try to ask. I need to be realistic with you. I have a feeling it's going to be very emotional to get that information, but it is important information for us to continue to fight against. And I forgot to say my name, Assemblymember Anderson. So sorry. Please accept my apology for that.
Thank you. If you came upon that information as far as how many people might have been affected, I feel like that'd be really powerful data, which probably won't change my opinion of the bill. But it would be very interesting to know. Thank you.
Thank you. Next, we have Assemblymember Ornlicker.
Thank you, Chair, and thank you for bringing this bill to close this unfortunate loophole. I noticed there are several points in the bill requiring the obtaining authorization. There are 4 or 5, so good to catch them all. And I notice for all but the one on page 9, it's for every jurisdiction they've resided in the past 5 years. And the last obligation to obtain authorization doesn't have that limitation. So I'm curious why it's in some but not all, and why 5 years, and how did you get to those?
Through the chair to Assemblymember
Please go direct.
Thank you. Nathan Anderson for the record. I did not catch that, so it was oversight on my behalf of not catching the 5 years. I believe the 5 years was utilized just because that is consistent with some other items, but that was based upon some other advice that I had received. So the 5 years, I'm comfortable expanding that beyond the 5 years. I think the 5 years was just something that was used to be consistent. And then obviously for page 9, that would be a conceptual amendment to add in the 5 years. So that way it is in fact consistent. Thank you for bringing that up, by the way.
Members, any other questions? No. Assemblymember Anderson, can you talk a little bit about, there were additional recommendations from the December 2024 report, complaint requirements that are not specifically defined. Can you just talk a little bit about why you're not proposing all of the recommendations?
Thank you, Chair, for bringing up that question. So when I initially had sat down to ask, because this is actually a speaker bill, because Speaker Yeager also felt that this was very upsetting when taking a look at this. When I initially had started doing some research behind it, I reached out to different individuals, whether that was some people with the state health area, some people with the local, and they believed that the idea of the posting of complaints, of having that consistent, that could be done in county regulations. I am open, however, to adding that into this bill. The only concern is that that could possibly be in a completely different chapter. And so I don't know if that would be germane or not. And so that was one reason why I did not add that one in there. The second item that was utilized had to do with from the January 2024 recommendation, and that was the training. I believe at this time more and more of these health facilities are now being required at the county level to have those items, and so I made the decision not to put it into there. Also because I was a bit concerned about the cost elements, knowing what all we were going with at the same time. I do believe the training should be a requirement, and I believe currently that is, based upon a discussion that I had with one of the counties, that is still a requirement at the county level. But the main thing that was probably the biggest one that I kind of struggled with is, do I put into this bill also the need to have the posting of how to do a complaint? Because that was another item that was not consistent across the different areas. But again, I made that decision not to do so because sometimes it is more important just to have the one topic that you're working on in this case. But I would be open to an amendment if the committee was wished to do so.
Thank you for getting that on the record. I appreciate you talking that through. Okay, members, any other questions? Seeing none, thank you so much for your presentation. We'll ask you to step back. At this time, we will open up testimony in support of Assembly Bill 521. If you are here to support this measure, please come forward at this time. As a reminder, 2 minutes. Also, if you are here in support in Las Vegas, you can come forward now. Go ahead, you may begin when you're ready.
Chair, members of the committee, Jonathan Norman with the Nevada Coalition of Legal Service Providers. We provide direct legal representation to over 3,000 kids in foster care at any given time in the state. I watched the audit subcommittee that Assemblymember Anderson was referencing, and like her, was shocked that there was this loophole. We appreciate her bringing the bill, and for Speaker Yeager giving her the extra vehicle, and thank you for your time considering it, and I hope you support it.
Thank you, Madam Chair and members of the committee. Reagan Comas with our partners here today representing Exquisite. As we know, the children in these facilities are among the most vulnerable populations. Many have already faced trauma, neglect, and abuse, and are increased risk for being targeted by traffickers. The unfortunate reality is predators often seek positions of access and trust within systems that are meant to protect them. By implementing mandatory background checks, we are taking a fundamental step to ensure that those entrusted with the care of these children are thoroughly vetted and have no history that could compromise a child's safety. Thank you.
Good afternoon, Chair, members of the committee. For the record, Serena Evans, Serena Evans, and I'm the Policy Director for the Nevada Coalition to End Domestic and Sexual Violence. As it's been said before me, a lot of times these children have experienced trauma, violence, and they're at increased risk for future victimizations, and so it is imperative that all staff and adults interacting with them are properly vetted. Thank you.
Good afternoon, Chair and members of the committee. My name is Madison Proctor. Maddison Proctor. I'm here on behalf of Nevada Women's Lobby in support of AB 521. This bill requires all agencies licensed by HCQC to investigate reports of abuse or neglect to a child and prevent healthcare providers who have been convicted of abuse or neglect from providing care. The chair of the Legislative Committee in Nevada Women's Lobby, Sabrina Schnurr, reported in 2023 on a Never Give Up Youth Healing Center, a psychiatric resident treatment facility. State agencies had document staff giving cocaine and children reporting sexual abuse allegedly committed by staff members. After years of documented concerns, it wasn't until the Review Journal reporting that the facility was closed. We want to see children in the state cared by those only with the utmost professionalism and concern for the children's welfare. The Nevada Women's Lobby is committed to keeping our children safe, and this important measure ensures it. We need to protect the most vulnerable children by preventing them from being cared for individuals who have history of abuse or neglect. We urge you to close this loophole and prevent predators from having access to our children in Nevada. Thank you.
Thank you, Chair and members of the committee. My name is Tim Provost, Timprovost, Director of Recruitment for Raise the Future, here testifying in support of AB 521. Raise the Future strongly supports AB 521, which strengthens requirements for background checks for employees and volunteers working with children in foster care. Our mission at Raise the Future is to connect youth in foster care with permanent and supportive relationships, and ensuring they are surrounded by safe and vetted adults is a critical part of that work. By requiring fingerprint-based background checks before individuals begin their roles, this bill upholds the safety and well-being of the youth we serve. AB 521 is a vital step in protecting Nevada's most vulnerable children and maintaining public trust in our foster care system. Thank you.
Thank you. Seeing no one else here in Carson City in support and no one in Las Vegas, AVH, is there anyone on the telephone line who would like to offer testimony in support of Assembly Bill 521?
If you would like to testify in support of Assembly Bill 521, please press star 9 now to take your place in the queue.
Hello, my name is Carissa Pierce again, CarisssaPearce, and I represent the Children's Advocacy Alliance. We are in strong support of AB 521. This bill prioritizes the safety and well-being of vulnerable children. It is a necessary proactive measure that helps prevent potential harm to children. People with a history of abuse of children should never be in a position or employment where they can interact with or care for vulnerable youth. This is an incredibly necessary step in ensuring that harmful adults are not given the opportunity to harm in our care facilities that are meant to be safe spaces. We are responsible for protecting our youth, which starts with who we let care for them. CAA would like to thank the sponsor for bringing this bill forward and for all of you for closing this harmful loophole. Thank you.
There are no other callers to testify in support at this time.
Thank you, AVH. This time we'll move into opposition testimony. If anyone is here who offer testimony in opposition of Assembly Bill 521, please come forward here in Carson City and in Las Vegas. Seeing no movement, AVH, is there anyone on the telephone line who would like to offer testimony in opposition of Assembly Bill 521?
Chair, there are no additional callers to testify at this time.
Thank you, AVH. This time we'll move into neutral testimony. If there's anyone here who would like to offer testimony in neutral on Assembly Bill 521, please come forward at this time here in Carson City and in Las Vegas. Seeing no movement. AVH, is there anyone on the telephone line who would like to offer testimony in neutral on Assembly Bill 521?
Chair, there are no additional callers to testify at this time.
Thank you, AVH. At this time, we'll call our bill sponsor back and no closing comments. We're being waived off. Thank you so much. At this time, we will close the bill hearing for Assembly Bill 521. We will now stand in a brief recess while we wait for our Assembly member to come back for our next presentation. Members, we're going to call back to order. This is what you call baseball. We're gonna pinch hit, as this is a committee bill. So we will welcome our committee member, Assemblymember Gonzalez, to the table, who will present this measure, Assembly Bill 516, for us. And I do understand we have an expert in that is able to help us. Yes. Okay. Super. Thank you.
Thank you. Hello, members. Good afternoon, Chair Brown May and Vice Chair Wynn and fellow committee members. My name is Assemblywoman Cecilia Gonzalez, and I represent Assembly District 16 in Clark County. Thank you for allowing me to present Assembly Bill 516, which comes from the Joint Interim Standing Committee on Health and Human Services. This bill seeks to improve access to health care for Medicaid-eligible students and ensure providers have adequate support to properly bill for services. Currently, there are approximately 36,000 children in Nevada enrolled in Medicaid. For many of these kids, school is where they access critical healthcare services. The state has a social health services program, which is a partnership between Nevada Medicaid, the Department of Education, school districts, and public charter schools. The program covers healthcare services for children at school, including preventative screenings, nursing care, rehabilitative therapies, and behavioral health services. As of 2024, 10 of the 17 school districts were enrolled in the program, but only 9 were billing for services, and even that was happening sparsely. Billing Medicaid is particularly challenging for schools, largely due to the lack of knowledge and resources. This bill seeks to address that problem and further expand services to ensure that children have adequate access to the health care they need for proper growth and development. I will now briefly walk through sections of the bill. Section 2 of the bill requires the director of DHHS to take any necessary actions to ensure that schools are able to receive reimbursement for healthcare services covered by Medicaid when those services are provided on the school premises. Additionally, this section requires the director to establish a program of incentive payments that increase the effective Medicaid reimbursement rates to a certified community behavioral health clinic or federally qualified health center that enters into contracts with schools to provide services to Medicaid-eligible children. Section 3 requires the School Health Access Resource Center within the Division of the Health Care Financing and Policy of DHHS. This resource center will assist Medicaid providers and schools to evaluate and utilize different methods of participating in and billing Medicaid with the intention of making it easier for schools to participate in the school health services program. Section 6 requires the department to amend the state plan for Medicaid to increase reimbursement rates by at least 5% for services provided, again, on school premises, increase reimbursement rates by at least 10% for services provided by a school-based health center, and simplify and streamline the methodology for reimbursing primary care and preventative services when provided at a school-based health center. With that, I will take any questions the committee may have. I will say, as an educator and as a student who grew up in CCSD, remembering getting some of these services throughout my childcare, it's very important and imperative that we help our schools make sure that they're, one, able to provide this care, and two, be able to be reimbursed for the care that they are providing for our most neediest families. And so with that, I will take questions.
Thank you for your presentation. Thank you for pinch hitting. We appreciate that. Members, are there any questions? I see no questions. Thank you. Do you want to offer neutral testimony? Is there anything? No, we're good. Okay, great. Thank you for your presentation. At this time, I'll ask you to step back. We will open up testimony in support of Assembly Bill 516. If you would like to offer support of this measure, please come forward here in Carson City and in Las Vegas.
Good afternoon, Chair and Committee. My name is Sabrina Schnur, Sabrina Schnur, and I am here this time on behalf of the Nevada Primary Care Association, the state's FQHCs. We would like to thank Assemblymember Gonzalez for her great work on this bill, and thank you for the inclusion of FQHCs in this bill. Thank you so much.
Hello, good afternoon. My name is Amy Hines Sutherland, Health and Human Services Manager for the Nevada Association of Counties, AMYHYNE-SUTHERLAND. And I just want to thank Medicaid for working on this. Our members support the development of the Health Access Resource Center. It's often the case that a lack of technical assistance is the barrier to the development of new services. And so our members support this bill, and thank you to the committee for bringing it during the interim.
Let me see. Good afternoon, Madam Chair and members of the committee. For the record, my name is Mary Brzezinski, here representing Nevada Association of School Superintendents, and we're supportive of this bill. We have a lot of kids in our schools on Medicaid, and anything that can simplify the billing and help us with the billing is much appreciated. So thank you, Assemblymember Gonzalez. Thank you.
Thank you. Seeing no one else here in support in Carson City and no one in Las Vegas, ABH, is there anyone on the telephone line who would like to offer testimony in support of Assembly Bill 516?
If you would like to testify in support of Assembly Bill 516, please press star 9 now to take your place in the queue. Chair, there are no callers wishing to testify in support at this time.
Thank you, ABH. At this time, we'll take testimony in opposition on Assembly Bill 516. If you would like to offer comments in opposition, please come forward at this time. Seeing no movement here in Carson City and none in Las Vegas, ABH, is there anyone on the telephone line who would like to offer testimony in opposition of Assembly Bill 516?
If you would like to testify in opposition to Assembly Bill 516, please press star 9 now to take your place in the queue. Chair, there are no callers wishing to testify in opposition at this time.
Thank you. At this time, we'll move into neutral testimony. Is there anyone here who would like to offer testimony in neutral on Assembly Bill 516 in Carson City or in Las Vegas? Seeing no one, ABH, is there anyone on the telephone line who would like to offer testimony in neutral on Assembly Bill 516?
Chair, the public line is open and working. There are no other callers at this time.
Thank you. Seeing that our bill presenter is now back up at the table, we will go ahead and close the bill hearing on Assembly Bill 516. Thank you for taking on that measure. That moves us to the last item on our agenda, which is public comment. If you would like to provide public comment here in person in Carson City or in Las Vegas, please come forward at this time. To provide public comment on the telephone, you will dial 888-475-4499, and then when prompted, provide the meeting ID 870-308-83942, and then press the pound sign. Seeing no one here in Carson City and no one in Las Vegas wishing to offer public comment at this time, ABH, is there anyone on the telephone line who would like to offer public comment?
Public lines are open and working. There are no callers at this time.
Thank you, AVH. This concludes our business for today, this Friday, April the 4th. Members, we will see you again on Monday and hope you have a wonderful weekend. This meeting is adjourned.
Thank you, Chair.